everyone, and welcome to the 124th annual meeting of Mount Desert Island Hospital. Again, as we started this meeting today, we are here to celebrate this wonderful community and all of us who are everyday heroes. Unfortunately, we are on a virtual platform again, but we are so looking forward to seeing you all safely in person very soon. The meeting format tonight will be a bit different. Along with our president, chair, treasurer, and governance reports, we are excited to recognize and celebrate healthcare heroes. Today, I want to start off by thanking our outstanding team at Mount Desert Island Hospital, our health centers, and Birch Bay Retirement Village for staying pandemic strong over this past 18 months. Our 554 employees are truly our everyday heroes, demonstrating MDI Hospital and Birch Bay Retirement Village 6 core values. Their lived experiences of these values has been transformational. They are compassionate, they are community-led, they strive for improvement, they walk in integrity and respect each day, and they are a team. Beyond the hospital's walls, our heroes have volunteered valuable time and expertise, partnered for an effective island-wide pandemic response, and provided essential support to help keep this community safe and protected. And I remember that cold, frigid, rainy Friday night, March 13th, 2020, when we tested our first COVID patient and started this pandemic journey. That night, everything changed, and we could not have predicted how challenging the next year would be. And yet, our beacon, this hospital, shone strong with support, caring, planning, and expertise. MDI Hospital pivoted to help keep our region safe and prepared, deploying initiatives to counteract COVID-19 through testing, treating, preventing, vaccinating, educating, keeping our community safe, our residents in Birch Bay healthy, safe, and vibrant, and celebrating the work of our team each week through our Everyday Heroes campaign that you were able to see some of today. When I stepped into this role as president and CEO, January 1st of this year, our nation was facing some of the darkest days of the pandemic, and MDI Hospital was still weeks away from conducting our first mass vaccination clinic. And now, less than 1 year later, I am thrilled to be able to say that this island is over 95% protected through vaccination to COVID-19. I'd like to introduce some slides that we want to share with you during this time, just to highlight all of those major attributes and things that we have done in this past year. And I will not read all these slides to you, but they will give you an idea of the effort that this amazing organization has done to protect our community, to keep everyone healthy and vibrant. After a year of so much hardship, this number is a phenomenal achievement of over 95% vaccinated. Within this number are thousands of heroes who are making a positive difference to this community every day. Together, our pandemic response has been an encyclopedia of healing, collaboration, teamwork, and learning. And this remarkable response would never have been possible without the support of our dedicated and generous donors and volunteers. I am humbled to report to you today that over this past year, our community contributed a record-breaking $2.7 million of critical life-saving support. And I am so thankful for our incredible community of patients, volunteers, donors, and friends. In every act of your generosity, in every act of your gratitude, and in every act of giving, you become our hero. You have stood with us every step of this way and empowered our response to this crisis. In uncertain times, we came together to ensure that our patients were cared for, our facilities were well maintained and prepared to take care of anyone who entered them. And with strength and determination, we continued to plan for the future of healthcare on Mount Desert Island, providing hope for a brighter, healthier tomorrow. And we are so looking forward to the future, and I am so optimistic about this. The future is bright. We are embarking on long-range planning efforts to improve our core services in our emergency department, our surgical suite, and a dedicated main entrance to the hospital. And we are still a very strategic organization. We focus on the implementation of our strategic initiatives, and our main priority this year is the implementation of a single source of truth, or an electronic health record called Community Works by Cerner, along with our community health needs, our strategic goals around improved access, workforce retention, rural medication, integrated mental health care, and improved age-specific care continuums, along with being an equitable organization. All of those focuses will continue while we still navigate this public health emergency and pandemic. With your help, MDI Hospital is leading the way to pursuing whole person community-centered integrated medicine, building a bridge from healthcare to well care. As we embark on a number of new initiatives, our caregivers are continually learning, growing, and improving to face the challenge of 21st century medicine. During this pandemic, our focus never wavered from providing quality care, excellent service, and a superior patient experience. Although the pandemic is and will continue to be a globally shared experience for quite some time, and we all hoped it wouldn't be until this time, we at MDI Hospital and Birch Bay Retirement Village continue to focus on improvement. And we celebrate some of those recognitions with you. Over the past year, we were named a top performer and received an award by Health Grades for the highest patient experience of US hospitals. We were designated as a diagnostic imaging center of excellence. We received the best wellness employer, a gold certification. And of course, many of you may have been tied up while we brought a 140-foot tractor onto this island with our groundbreaking MRI. This fixed place project will be the leader of new technology and caring for our community close to home. Our community has proven that we can unite to face whatever comes our way. And I am pleased to take time tonight to start to recognize and share these efforts of dedication of so many that have contributed to these incredible numbers of prevention and mitigation and sharing for each other with our first ever Community Hero Award. And now it is my pleasure, so bear with me, I have to get this right, to announce the recipient of our first Community Hero Award, and now Elsie Fleming and the Downey's COVID-19 Task Force. The Downey's COVID-19 Task Force was established in the early days of the pandemic as a community leaders all came together to help prepare and respond for this public health emergency. Task force partners included MDI Hospital, Healthy Acadia, the Jackson Laboratory, the MDI Biolaboratory, College of the Atlantic, our local school system, Acadia National Park, our towns, our Chamber of Commerce leaders, and local legislators. As the task force began, Elsie stepped into a lead role, facilitating meetings, connecting partners, and coordinating strategy and outreach. Together, task force partners established a hallmark asymptomatic workforce testing pilot, vaccination promotions, education efforts, and medical grade mass distribution, and an expert resource for this amazing community. The task force has played a critical role in protecting the MDI community throughout this pandemic. And Elsie continues to serve as that connective leader, guiding discussions of ongoing challenges as the task force continues to provide innovative community solutions. So tonight, please join me in thanking Elsie and honoring her and the Downey's Task Force with this award. We are so thankful to you and your task force partners for your unwavering commitment to the health and safety of our community and your continued dedication and service. Oh, it went away, Elsie, and I practiced too, but congratulations and thank you so much. So well deserved. Your partnership in all that we do to keep this community and our populations healthy is so remarkable. We're very, very appreciative. I'd like to turn it over now to Patricia Hand, who is the chair of our Board of Trustees. Patricia?
Yes, hello everyone. Thank you, Chrissy. Good afternoon. I am Patricia Hand, chair of the Board of Trustees of the Mount Desert Island Hospital. You know, in thinking about the last year, I have been truly humbled and profoundly grateful for the outpouring of generosity and kindness demonstrated by our community. Your unwavering support has been a lifeline throughout these difficult times and has provided the hospital's healthcare team, and really the whole hospital, with the necessary supplies and equipment to protect you, your family and friends, and our entire community during the COVID-19 pandemic. My fellow trustees and I continue to be inspired by your dedication and commitment to ensuring that everyone on Mount Desert Island, residents and visitors alike, has access to the high quality and compassionate health care they most certainly deserve. Together, we are building a healthier future for everyone in our cherished island community. And so on behalf of all the trustees, we thank you. We thank all of you for being a part of our MDI Hospital family. And so now, in continuing with the Heroes theme, it is a true honor for me to be able to announce two local businesses as co-recipients of our 2021 Business Hero Award, the Bar Harbor Bank and Trust and the Bar Harbor Regency. Let me see if I can do this as well as Chrissy. Bar Harbor Bank and Trust is being recognized for its outstanding support for the Mount Desert Island community with a significant grant to support MDI Hospital's COVID-19 testing initiative. This was developed in collaboration with the Down East COVID-19 Task Force. This grant was targeted to benefit the MDI regional school system as they strive to keep students, staff, and schools healthy and safe. This asymptomatic testing initiative yielded one positive result out of 1,409 total tests completed and was truly an incredible feat. And so thank you very much. Thank you to Curtis Simard, who is the president and CEO of the Bar Harbor Bank and Trust. Thank you to the bank's board of trustees and everyone at the Bar Harbor Bank and Trust for your phenomenal support of MDI Hospital and for helping to protect and care for our community throughout the last year. And I have the pleasure also of announcing the co-recipient of this award. Thank you to Evan Salvatore, Director of Local Operations for Ocean Properties and Ocean Properties Hotels and Resorts, who were integral to the hospital's COVID-19 pandemic response by providing use of the Bar Harbor Regency and the Hotel Stonehouse to hold a mass vaccination clinic for the greater MDI community. Over the course of 6 months, more than 7,300 doses were administered at that location, with the final vaccine clinic held on June 14, 2021. This monumental effort contributed to the fact that more than 95%, and that's amazing, 95% of the MDI community is fully vaccinated today. And so thank you to Evan, Ocean Properties, and the Bar Harbor Regency for being an important part of this historical effort. To everyone at Bar Harbor Bank and Trust and the Bar Harbor Regency, we are so very grateful for your incredible support of MDI Hospital and our island community during this year. Thank you so much. Our clapping. And next, please join me in welcoming Michelle Smith, who is Vice President of Finance and the Chief Financial Officer at MDI Hospital. Michelle will give the treasurer's report.
Thank you. Good evening, everyone. It gives me great pleasure as your newly appointed Treasurer and Vice President of Finance, CFO, to deliver the FY 2021 Treasurer's Report for the Mount Desert Island Hospital Organization, an organization that strives every day to deliver on its mission statement to provide compassionate care and strengthen the health of our community by embracing tomorrow's methods and respecting time-honored values. I am pleased to share that once again this year, the MDI Hospital, health centers, and Birch Bay Retirement Village ended the fiscal year with a positive operating margin and a total margin of 14%. This is an outstanding accomplishment while being faced with many challenges during a pandemic. I'm proud to state this is the 7th consecutive year with a positive operating margin. During FY 2021, we also provided in excess of $5 million in free and uncompensated care and paid $1.1 million in hospital tax. What allowed us to be the successful, one might ask? The $2.7 million in generous donations in support from our community, along with state and federal grants that were made available under the Coronavirus Aid, Relief, and Economic Security Act, also known as the CARES Act. These both were major contributing factors, allowing our organization to remain financially strong and viable during this pandemic. Both the hospital and Birch Bay were recipients of grant funds through the Payroll Protection Program, also known as the PPP program. We received over $7 million in funding. Both entities were successful in demonstrating to the Small Business Association their ability to maintain the staffing levels and compensation and benefits at pre-pandemic rates. This substantiation resulted in these funds becoming grants for both organizations and were reported as other income in the audited financial statements. Volumes were significantly impacted at the start of the fiscal year as our health centers were closed to non-essential visits and our operating rooms were open only for emergent cases. Fortunately, we were able to regain some of that lost volume as the fiscal year went on and we were able to safely reopen for services. I am pleased to report that we provided over 79,000 outpatient visits on behalf of our health centers and imaging department. We ran in excess of 132,000 laboratory tests, performed over 1,600 surgeries, treated over 4,500 emergency patients, and had over 850 discharges from our inpatient units. Birch Bay Retirement Village sustained an occupancy of 95% with a singular focus on the safety and well-being of our residents. During the fiscal year, we committed to two very important and strategic capital projects, one being a fixed place MRI and the other being the replacement of our many electronic health records with one seamless and efficient platform provided by Cerner. These two projects combined for a total cost of approximately $7.7 million. $6.9 million of the necessary funding was secured through financing with the Healthcare Division of the Finance Authority of Maine, with the additional funding being provided from our generous donors. The MRI is approaching completion with a goal of performing its first test by mid-September. The Cerner implementation is well underway and scheduled for go live on March 7th of 2022. In tandem with the Cerner implementation, we will also be replacing the financial reporting software that is used both here at MDIH and at Birch Bay Retirement Village. Multiview is scheduled to go live on February 1st, 2022. Lastly, I would like to close by stating how honored and humbled I am to serve as a member of the leadership team for this amazing organization. An organization that focuses on its independence and demonstrates its missions, vision, and values in every way. Thank you. Now I have the distinct honor this evening of recognizing MDI Hospital and Birch Bay Retirement Village 2021 Employees of the Year. I will begin with the 2021 Employee of the Year for Mount Desert Island Hospital is Cheryl Young. Cheryl serves as the practice manager of Cooper Gilmore Health Center General Surgery in the COVID-19 testing pavilion. She was instrumental in establishing and managing the hospital's centralized location to provide testing for our patients community members, and retirement village residents throughout the pandemic. Keeping the community's best interest at her main focus, Cheryl worked closely with her team to provide high quality, compassionate care to every patient who came through our doors. Congratulations, Cheryl. The 2021 Employee of the Year for Birch Bay Retirement Village is Sarah Lyons. Sarah serves as the Activities Assistant for Birch Bay Retirement Village and has worked tirelessly during the last year to safely engage with our community most fragile population in creative and meaningful ways. During the most challenging days of the pandemic, Sarah assisted residents with Zoom calls to keep them connected with loved ones when in-person visits were not possible. And she went above and beyond to offer an internal exercise program to help keep residents engaged in activity and in a healthy lifestyle. Congratulations, Sarah. Thank you to Cheryl, Sarah, and all of the employees in Mount Desert Island Hospital Organization for all that you do for the better health and well-being of our island community. Thank you. Now it is my pleasure to introduce Trevor Casey, pharmacist and Vice President of Innovation and Experience.
So to date, MDI Hospital has given over 12,000 COVID vaccines, and we continue to vaccinate those 12 and up at our Community Health Center, Trenton Health Center, and Cooper Gilmore Health Center. And we're proud to be a part of a community who's coming out to get vaccinated. You are the true heroes that we work with day in and day out. Your heroics have led to our community being over 95% vaccinated, which if you can't tell, we're very, very proud of. And we're excited to also announce that the Pfizer vaccine is now FDA approved, and we expect Moderna and J&J to follow shortly. However, we're not done. There are those that still need to be vaccinated, and those younger than 12 that don't have access to vaccination option at this time. Also, boosters are here for those immunocompromised patients. If you are immunocompromised, please work with your providers to see if you qualify for a booster dose at this time for your protection and the protection of your loved ones. Starting September 20th, booster doses will be available for those that have been fully vaccinated for at least 8 months. So that will start with healthcare workers, and our super seniors will be the first to get those booster doses. And then we'll be moving through as we did in December and January and throughout the rest of the vaccination process. We are encouraging people to align, if possible, their flu vaccine and their COVID boosters at the same time. Please look for more information about how to receive your COVID booster and your flu vaccine in the upcoming months and weeks. And now it is my pleasure to talk about our COVID vaccination process. Throughout the COVID vaccination process that started in December of 2020, many of our community members and our MDI team members stepped up and volunteered at our mass vaccination clinics. We could not have done it without your support and perseverance. It was my pleasure to work side by side at the Regency with you and learn from your experience, laugh, and work together to accomplish a massive undertaking. And now it is my honor to present with our 2021 Volunteer Hero Award to one of these outstanding volunteers, Dr. Ellen Gellerstedt. Ellen, it was just wonderful to work with this entire time. From March to June of 2021, Dr. Gellerstedt spent over 90 hours volunteering at MDI Hospital's vaccine clinics at the Regency, more than any other volunteer. In addition to the time she spent in Bar Harbor, she was also at the Cross Insurance Center, giving vaccinations there as well. As a developmental pediatrician, Dr. Gellerstedt practiced medicine and taught at the University of Rochester in New York for over 30 years. After coming to Little Cranberry Island since 1980, she relocated in Maine in 2005 and was head of the developmental pediatrics program at Eastern Maine Medical Center until her retirement in 2018. Since retirement, Dr. Gellerstedt splits her time between Bar Harbor and Little Cranberry. Mary Parham, MDI's Community Health Education Coordinator, and also our guide person for finding and collecting volunteers during this process and aligning them, said about Dr. Gellerstedt, Ellen always arrived early for the clinics and was a real go-getter. It was not unusual for her to volunteer to pick up and cover patients while her teammates took breaks or as needed. She hardly took a break herself and was always stepping up to help. Thank you, Dr. Gellerstedt. It has been my pleasure to work with you and learn from you. Thank you for your incredible selfless effort to help care for and protect our community. We are stronger together because of you. And now I'm going to turn the time over to Elsie Fleming, our chair of our governance committee.
Thank you, Trevor, and all of you. Wonderful to be here with you all tonight. Wish it could be in person, but glad we are staying safe. Before we go on, I just want to give a quick and heartfelt thank you, since I'm here, to Chrissy for your really kind and generous words regarding the Community Hero Award. And I just want to dedicate, because I know there are a number of task force members on in this Zoom meeting tonight. I really want to fully dedicate that award to the entire COVID-19 task force, who have been members, who've been such incredible leaders and partners in this important and difficult work. So thank you all. So on to my role as chair of the Hospital Governance Committee. As those of you who are incorporators probably know, you have a number of important roles here at MDI Hospital. You serve as goodwill ambassadors for the hospital. You guide us as community advisors. Your liaisons back to the community, advocating and educating around MDI Hospital's role in providing quality health care. You stay informed about our programs and services, including public policy issues, and at times you act on those issues. You support the hospital and our programs and services with your greatly appreciated contributions. You also have the responsibility to elect and re-elect the incorporators and board members for MDI Hospital. And that's what we are here to do today. So I have the happy duty each year to facilitate this process. And although we hoped last year would be the one and only time we would have to do this on Zoom, at least now we've had practice and we're staying safe. So what happens next is I will briefly share my screen to show you the names of the incorporators. That we have a list of renewing incorporators, re-electing incorporators, and new incorporators. And then you all, so all of the incorporators here tonight will vote on those nominations. So I'll guide you through the process. We'll need a motion to approve and second, and then everybody will say aye or yes in the chat. Write it in the chat if you're able. And when the time comes, if you disapprove, you'll put no or nay. Just as a reminder, you all should have the ability to find the chat at the bottom of your Zoom window. I know computers are all a little bit different, but when you click on that chat button, a chat window will appear, and you find to everybody or to everyone by clicking on the drop-down menu next to to. Then you type your message in the chat, press enter, and send your message. So again, go ahead and find that chat box as I share my screen with you. All right. So now maybe panelists can confirm that you can see, and hopefully everyone can see. Good, good. Anybody chat if you're not able to see it, but here are the returning incorporators for a 5-year term, as well as the new incorporators for the 5-year term. So I'll give you a chance to take a peek at that and look through those names. And in just, oh, actually, maybe I can, okay. So, so Ian is saying that there is not an opportunity to share with everyone. Thank you for that. I see that. So we'll go ahead and, so you won't all be able to see what's happening, but we are able to. So we can go ahead and start with the voting. So we just need somebody to, if willing, make a motion. You can write in "so moved" into the chat to make a motion to elect. Wonderful, Louise Susi moved election, and then we've got a second. So we've moved on there. So everybody who's able, you may not see each other's chat, but I'm able to see it. So go ahead and put aye or yes, yay in the chat. We'll give it a few minutes. Thank you all. Excellent. Excellent, excellent. Thank you. Give it a few more minutes. I'm seeing a question about somebody not seeing their name as an incorporator. This is right now we're just showing names of folks who are renewing their term this year, whose 5-year term has ended, as well as those who are new would be newly elected as incorporators. So if you're on, if we'll connect later, but if you're in as, oh, yep, got it. Good. Thank you. Thank you. Question was answered. Okay, terrific. So yes, this is not all incorporators. Many of you are not listed, just folks who are renewing their terms or newly coming on board. All right. So I think we have a resounding yes. Does anybody not approve for any reason? You can pop it in the chat box. All right. And so I think with that, we will end the screen share. Thank you all so much. So we have an approval of all incorporators. Thank you. Congratulations to new and returning incorporators. Thank you so much to all of you, all incorporators, and all of you here tonight for your incredible service. So next up, we will be doing this for the board members. So these are board members that have been nominated by the hospital board coming to you tonight for a vote. You should have received a packet in the mail with the bios of the board members who are up for re-election tonight. We are re-electing 5 board members: Ed Gilmore, MD, Patricia Hand, PhD, Julian Kufler, MD, Martha Wagner, PhD, and Noel Wolf. So those are the 5 that are re-electing. I'll mention in a minute 2 ex officio members who are coming onto the board. But first we have, oh, thank you. And Danny shared a full list of incorporators, so you can see yourself there. And if for some reason you're not there, just reach out to us. And so we have those 5 members. You've seen their bios. Do I have a motion for approval of those members? All right, wonderful. Got a motion and a second. Terrific. We have a second. And so now it's those in favor, please share in the chat. Excellent. Wonderful. Coming in. Terrific. Wonderful. It's all coming on in. Excellent. Give it one more minute. Make sure everybody's voice is heard. All right. Terrific. And are there any opposed to the elections? And feel free to keep chatting a yes if you hadn't gotten there. All right, seeing none opposed, it is also unanimous that these 5 board members are re-elected. Thank you all so much for your guidance and leadership and support moving this important work forward. And as I mentioned, there are 2 board members coming on board now. Dr. Peter Witham joins our board as an ex officio trustee by nature of his role as the president of the hospital medical staff. And Enoch Albert joins in his role as the board chair of Birch Bay Village. So we're very lucky to have them in service in the board as well. So congratulations to all of you incorporators and board members, and thank you so very much. All right, so next I have the wonderful honor and privilege to present the Leadership Award. So I am just so honored and grateful to be here presenting this to Arthur Blank for your more than 20 steadfastness, and heart. As president and CEO from 1999 to 2020, Art embodied all these qualities and more as he led MDI Hospital through a period of unprecedented growth and change. It is because of his dedication and passion that MDI Hospital remains strong and independent, with decisions about our care, our operations, and our future being made right here in this community. He guided our transition to a critical access hospital to help keep essential services in our community, particularly around the clock emergency care. Under his leadership, MDI Hospital incorporated 9 health centers and launched countless innovative public initiatives and partnerships. Art championed the advancement of evidence-based emergency care at MDI Hospital, made possible by a long-term partnership with Penn Medicine. And he initiated a range of educational opportunities to foster young medical students and to inspire their preceptors. Art launched many successful capital campaigns, including renovation of the MDI Hospital's inpatient and obstetrical units in 2007, construction of the Lisa Stewart Women's Health Center in 2014, and acquisition of a new state-of-the-art emergency generator in 2018. Art reached beyond our region to collaborating with the nonprofit sector to uplift healthcare in this rural state. One of those partnerships has led to a new substance treatment center and hub and spoke system in our region to help those struggling with substance use disorders across the Down East. Another has significantly benefited rural hospitals throughout Maine. Art helped shape policy, share resources, and craft new approaches to the challenges of keeping Maine's people healthy and keeping our state's hospitals competitive and responsive. As a leader, Art made MDI Hospital a leader too. In 2016, MDI Hospital was named Trauma System Hospital of the Year by Maine Emergency Medical Services, a major honor demonstrating our emergency department's growth and progress. And of course, he led us through the first year of COVID-19 with grace and tireless dedication, doing so much to keep our communities safe and our healthcare strong, and then pass the baton on to our wonderful Chrissy, for which we're so grateful. Although Art retired from MDI Hospital on December 31, 2020, the initiatives that he presided over during his more than 2 decades as president and CEO have made a lasting impact on our community's health and well-being. Art is a visionary. He's deeply passionate and compassionate, and he works tirelessly with so much kindness and thoughtfulness to those around him. Art, in addition to the extraordinary work that you did for our hospital, our communities, our state, and beyond, you've also been an incredible mentor, guide, colleague, and friend to me over the past 14 years that we've been able to work together. So here, if I can show this. Art, you'll get this in person soon. Thank you for your invaluable leadership. It's with an incredible sense of honor, gratitude, and privilege that I present this leadership award to you today. Thank you. So next up, we'll pass it back to Chrissy McGuire for the next 2 sections. Thanks, Chrissy.
Oh, Elsie, thank you. And thank you for that wonderful, thoughtful presentation and recognition. Continuing on that theme, Art, we had so hoped to do something in person with you this summer. And unfortunately, as COVID started to rear its Delta variant, we really paused and want to make sure everyone stays safe and healthy. So in honor of your outstanding leadership and service, it's my pleasure to present a very special gift to you. A beautiful portrait was painted by Mary Turness, and we look forward to delivering it to you in person, and we will be sharing an image of it shortly. Art, it is very hard to quantify all that you have done for this hospital and our community during 20 years of service and dedication. More than anything, your legacy is evidenced by this healthy and vibrant community that we live in. And as we continue to reflect on your incredible legacy in the days and years to come, we invite all of you to preview a very special film directed by Peter Logue to commemorate all of your outstanding leadership. We're showing you the picture that will be delivered to you shortly, the work that Mary did as you led us for the past 20 years throughout this community, throughout this region, and throughout the nation as a true leader in healthcare change. And again, thank you, Art, for your tireless commitment and ongoing service to this community, for I know that your work will never be done and you will continue to volunteer to inspire so many and do all of the good work that you have always done to keep all of us safe and healthy. With that, our next award is a Healthcare Hero Award. And it is my pleasure to be able to give this award. And if I can make it all the way through without tearing up, it will be a miracle. The recipient of this award for a healthcare hero is Dr. J.R. Crevens. He demonstrates what healthcare heroism is. He is such a dedicated leader, such a resource, such a great peer and friend that I am just honored to have him here at our facility. In the early days of the coronavirus pandemic, Dr. Crevens was quick to establish a leadership role in the hospital's coronavirus efforts, drawing on his extensive expertise and background in public health, emergency preparedness, and management of infectious disease. JR has been a guiding force for our institution's pandemic response and our educational initiatives. He serves as our chair of infection control, and he is a key player in the formation of the Down East COVID-19 task force. He has served dedicated hours to researching and understanding the latest data and translating that into information that we can understand and what the community can understand. And regularly, he serves as a panelist on our hospital's virtual town hall sessions. I thank you, JR, for your leadership, your guidance. It has been essential to the greater Mount Desert Island, this region throughout the pandemic. And we are so grateful for your commitment to knowledge, public health, and safety. It is with deep appreciation and gratitude that I'm able to honor you tonight. You are a diadem. You are a gift to this organization and community for which we are so deeply appreciative. And I am so deeply appreciative knowing that you are here with me, guiding us through this public health emergency and pandemic. Thank you so much. So our next awards are recognizing those that we lost. These are known as our Luminary Awards. The 2021 Luminary Hero Awards are presented this year in memory of Lonnie K. Nahi and Lucife Estrada Estacio. In each of their careers at MDI Hospital, these strong, incredible women made a tremendous impact on our lives and of everyone they encountered. Sadly, both Lonnie and Lucife were diagnosed with glioblastoma multiforme within months of each other in 2020 and lost their battles to this terrible disease in 2021. With their vibrant dedication and commitment, both Lonnie and Lucife were bright lights within our organization, and their important work made possible through their innovation, their compassionate, their care that is provided to our patients every day. As we strive to better serve our patients and community, we will do so with them in our hearts every step of the way. They light our path forward. They remind us of who we are and how we belong. In recognition of our honorees, our moderator will now share a tribute video. thank you again to all of our heroes. Simply cannot demonstrate enough who we are and what we're able to do without the support of all of you and all of these heroes. These are just a fraction of who we are. And we are so honored and blessed that they help serve to our mission to take care and steward this amazing asset. So in closing, I want to thank all of you again for joining us tonight for our and your steadfast support of Mount Desert Island, our hospital, our health centers, and Birch Bay Retirement Village. Although we hoped we would have this in person, we know that next year is another opportunity, and we will certainly make sure that we are together as soon as we can be. Truly, none of the work that we do is possible without you, our dedicated community, our amazing team members, our volunteers, our donors, all of the supporters, and our friends. As we are stewards of this community asset, we are so privileged to be given this opportunity to serve you. And as we work together to address today's challenges and prepare for those we will see in the future, I am more grateful than ever for this exceptional community. Thank you to I need to thank our communications team. They are the silent heroes and have been heroes throughout this pandemic. Thank you to Oka Hutchins. This past year, they have provided educational materials, videos, supported town halls, and have done a multitude of internal staff briefings. This virtual meeting was planned and coordinated by this amazing team, and they are our silent heroes. They keep us in line, and we're able to give you these reports and information and celebrations. This concludes our annual meeting and report to the community. Thank you for your generosity of your time tonight. And I hope you all have a wonderful rest of your evening. And I move to adjourn this meeting.